Hi guys! So this week I wanted to focus on major depression disorder because it is the most common disorder seen in a therapist's room, and a lot of people have depression. Depression is more common in women. For children, the onset of depression increases at puberty. The hormones are just crazy at that time. The average age of depression, the onset peaks in the 20s. The hallmark symptoms of depression are a loss of pleasure in activities that you once enjoyed doing, apathetic, and you appear withdrawn. Children and adolescents, the depression for them, they show it in somatic complaints and social withdrawal and irritability. The initial disruptions for a child with depression would be school performance, the desire to attend school, behavior changes, and it increases the risk for substance use. Depression is comorbid with other mental disorders like substance use disorders, panic attack disorders and panic attacks, OCD, eating disorders, and borderline personality disorder. So I wanted to talk about the cause of depression in a different perspective. Causes of depression are, depletions in neurotransmitters. These neurotransmitters are serotonin, norepinephrine, and dopamine. There could be depletions in one, two, or even all three. That is why there's different types of antidepressants, different types of medication. They aim at different neurotransmitters. That's why there's different ones. All three of these neurotransmitters are responsible for different types of things. Like norepinephrine, I think I'm saying that right, is responsible for wakefulness and alertness. You're feeling a little tired and having trouble concentrating, then you probably have a depletion in that neurotransmitter. Dopamine is responsible for behavior regulation, movement, learning, mood, and attention. There's a problem in any of these areas, then there could be a depletion in that neurotransmitter. Also, I wanted to point out that if there is overactivity or oversensitivity of the neurotransmitter of dopamine, that's seen in a lot of schizophrenia disorders. Serotonin is responsible for maintaining homeostasis in the brain, which is balance pretty much. It is responsible for mood regulation, appetite, arousal, and pain regulation. So if there's a problem with any of those, then probably need to get on a medication that aims at that neurotransmitter. I've also wanted to talk about the importance of not stopping your medication if you feel good, because I've heard a lot of people say that they stop taking their medication just because they feel better. Well, those symptoms come right back, so it's important that you stay on your medication for the treatment time that you have set up with your prescriber. There's a reason for that. The main treatments of depression are psychotherapy, medication, light therapy, and exercise. And I want to talk about all of those, but first I want to talk about the medications because I think that's important for people to know, but no doctor really explains this type of stuff. And I think it would be highly helpful if a doctor were to explain that kind of stuff. And I think that people would adhere to taking their medication more if they knew a lot more about what the medication does, So there's 4 main types of antidepressants. There are tricyclic antidepressants, also known as TCAs, and then there's monoamine oxidase inhibitors. I think I'm saying that right. Also known as MAOIs. And then there are selective serotonin reuptake inhibitors, also known as SSRIs. And then there is serotonin norepinephrine reuptake inhibitors, also known as SNRIs. And the fourth one is atypical antidepressants. So the TCAs are the older antidepressants. How they work is they prevent reuptake of neurotransmitter substance back into the synaptic cell. These medications are considered not clean, which means they affect non-targeted organs. And with these medications, there's a very high risk for overdose and suicidal ideation. MAOIs are considered a last resort medication. You have to follow a strict dietary guideline whenever you take that medication, because food that contains tyramine causes a hypertensive crisis. How this drug works, it inhibits MAO, which is an enzyme that breaks down neurotransmitters and renders them ineffective. And then with SSRIs, they block the reuptake of serotonin back in the presynaptic cell, allowing more serotonin to exert its influence on the postsynaptic cell. These medications are known to be cleaner, and they interact with fewer medications. SSRIs are also safer for those that are at risk for suicide overdose. The SNRI is much like the SSRI, but it includes the norepinephrine transmitter. And with this drug, it increases blood pressure at higher doses. And lastly, atypical antidepressants there's a less possibility of sexual dysfunction. Lots of antidepressants interfere with sexual dysfunction. And atypical depressants are mostly prescribed nowadays to help with appetite and sleep. And then the next type of therapy that I wanted to mention is the light therapy box, which is most used for those with seasonal depression disorder. And seasonal depression disorder usually comes during the winter times when the sun isn't shining as much. So you would get a light box and sit in front of the light box for about 30 to 60 minutes a day. This is a light box. Just turn it on and sit in front of it, like about a foot away from it. And then there's the free treatment, the one that nobody likes to do: exercise. Exercise actually helps to release important endorphins and neuromodulators. And you don't even have to exercise very much. You can even just walk for 15 minutes, even 15 to 30 minutes a day, and that'll do it. You just got to get enough to make your heart beat faster than it normally does. I will make a video this week of all the medications, like the important ones, the ones that most people are taking. I'll talk about some of those and the side effects and the ones that you should probably stay away from, and the ones that are pretty good. So follow if you want to know more.